Postpartum depression is misunderstood, and it's misunderstood across everywhere.
Hey Alex, how
Hey
are you?
Alyssa, how's it going?
That was a great
Zach,
weekend.
how are
I've
you?
got
We're not sleeping in busy projects.
How about you? Pretty busy. I had to navigate that new journey for
All right, I
him.
appreciate that. Thank you, Shannon.
Postpartum depression is it's a long-lasting form of depression, and it can happen throughout the pregnancy and even after the pregnancy. And I've been doing some research, I'm learning that, postpartum depression can last up to 5 or 6 years after the birth. And so we're getting more focus on how to support the mother and the father during the time of pregnancy. They can experience extreme mood. Sometimes you have moms, they may experience some psychosis. This is due to some hormonal changes, stress, from the pregnancy itself, fatigue, and maybe some anxiety about becoming a mother, motherhood. Now my life is changing. And so you might have heard people call it baby blues, but the symptoms are different, which I'm going to share. So the postpartum depression symptoms, you have your depressed mood or severe mood, crying, frequently crying, difficulty with bonding with the baby, withdrawing from your family and friends. You might have a loss of appetite or eating much more than usual, loss of energy, no interest in any activities, irritable, angry, fear that you're not going to be a good mother, hopelessness, restlessness, anxiety, some panic attacks, and thoughts of harming yourself or the baby. And then there may be some recurrent thoughts of death and suicide. And this is where that's when it gets serious. The baby blues, it usually only happen a few days to a week or two after the baby, whereas postpartum depression can be longer as to the time frame that I mentioned earlier. So with the baby blues, it's just for a couple of weeks or so after the baby, I'm having some mood swings. I'm feeling some anxiety, irritability. I'm feeling overwhelmed. I'm crying. My concentration or appetite problems or trouble sleeping. And it only lasts a couple of weeks. It's just, I would say baby blues is more of a mild symptom of postpartum depression, whereas postpartum depression can be long lasting. And then you have your postpartum psychosis. And this is where it's not the mood you have the postpartum depression, which is your mood disorder. And then you have your postpartum depression, which is your psychosis, which is its symptoms are severe. You feeling confused, you having obsessive thoughts about your baby, you're hallucinating and having illusions, sleeping problems, too much energy, and feeling upset. Whereas the postpartum depression is you have low energy and you feeling paranoid and you make attempts to harm yourself or the baby. So that's the difference between postpartum psychosis, postpartum depression, and the symptoms of baby blue symptoms are those just last a couple of weeks. Most of the moms, they get that, how when you see a pregnant mother, they go through. And then there is what we call peripartum depression. So peripartum depression is what's happening after the delivery, because it can be happening during the pregnancy and continue on after the pregnancy. Studies also show that new fathers can experience postpartum depression too. Yes. So that's an area that I'm learning more about, that they may feel sad, tired, overwhelmed, and anxious too about the pregnancy. Sometimes this mother is fine and it's the dad that's going through the postpartum depression. And especially if they're fathers who are young and have a history of depression or experience relationship problems, they struggling financially, or they are most at risk for postpartum depression during this time of becoming a father. The typical treatment, as we're talking about it for postpartum depression, like I said, it's important for them to talk with their doctor. It don't fade away after a couple of weeks. If you want to say something to your doctor, the services that are typical treatment, kind of like what I mentioned, the maternal infant health program, and they are a community-based program where they send a nurse, a nutritionist, and a social worker out to the home to do visits with the mom during the pregnancy and even after the pregnancy. But their visits are spread it out. It's different from the service we provide in infant mental health. Those services that we provide in infant mental health, we can see this mom weekly. We can be there weekly. We can go out a couple of days a week on a weekly basis. We can go with them to their OBGYN appointments if they want us to go with them to, help them to be able to advocate and communicate. If they're pregnant, it helps them to be able to have a plan for what it looks like when I get ready to deliver, how I'm taking care of my mental health. So the infant mental health program can be that support that they need from that level. Also, we have some moms that may need to be on medication because prior to the pregnancy, they were already experiencing some mental health concerns. And so they may need to be on an antidepressant or other type of medicine that is appropriate for the pregnancy. You have to be present, and that's the part about parenthood. You have to be present to your children. I know that when a parent have if they got financial issues, or I'm worrying about the bills, or we don't have house. I mean, if there's other factors involved, the first thing on the mom's mind or the father or the caregiver's mind is that my focus is on how we going to get through the next day. And so it takes away their focus on the caring of the baby. They're there physically, but not emotionally. So it's important for parents to be there emotionally, where they can set aside reading time or play time with their baby or the toddler child, because our infant mental health program, we can work with the pregnant mom, the father, or caregivers up until the child turns 6 years old if necessary. They have us that length of time. They have us there to help them with that if they need that. But without us, it's important to have playtime, reading time, doing meal time, talking to your baby. When you even feeding your baby, even though the baby's an infant, they understand. During the first 5 years, that is so critical of what they learn from their environment. And that if it's a healthy, safe environment all the way around, there's going to be obstacles. There's no perfect environment. We're not perfect parents either. But having that safety net emotionally, physically, and that the needs are being met allows for that child to develop. Now, if there's a child with special needs, because there are babies that are born with special needs, that the support system is there, that the services is there to help the mom and the father to be able to manage how to care for a baby with special needs. And another component to the services we provide with CNS Healthcare through our children's program is parent support partner, where that parent support partner have lived experience and can come in and help those parents that how they manage a child with special needs. And then our wraparound program, where we have someone to come in and help them to navigate with all the services that are in place to help the family not feel overwhelmed and help them to figure out what is working and not working, and that they be open to the services. Because it's one thing to need the support, but being open to utilizing the support available to you. Postpartum depression is misunderstood, and it's misunderstood across everywhere. And, people think how can a mother be this way or a parent be this way towards their children? Well, if they've diagnosed with a postpartum depression, it is a serious diagnosis, and that, the the mother not getting treatment, it can cause some harm to the children and the mom herself. And if the father experiencing it too, and the mother is okay, it still puts the mother and the child at risk, untreated. It is a misunderstood diagnosis, and there needs to be a lot of education about postpartum depression.
That was a great weekend. I've got
Busy projects coming.
It's pretty busy. I had that new surgery.
Thank you, Shannon.